Over the past 2 years, UNDP has funded an advocacy project building synergies for the right to advocate for health laws, policies, and practices in Uganda. Through this project, the Center for Health, Human Rights and Development CEHURD is working to improve access to essential medicines by influencing positive change in intellectual property rights, access to essential medicines by influencing positive change in intellectual property rights, and engaging communities and civil society stakeholders around issues relating to the rights to health.
I've realized one thing that when you go to the communities, you get different voices from the leaders, from the health workers, and from the community people themselves. But we've realized one thing, that we still have a lot to do with the sensitization. We need to inform the people of their responsibilities. Much as we talk of their rights, we need to inform them of their responsibilities. What the health workers have to do as their responsibilities, what the communities have to do, and what the leaders have to do.
Among the programs that were carried out in the project was the assessment of access to HIV medicines in Buyikwe district. As the initial part of the process, it engaged community stakeholders around issues of access to essential medicines as a fundamental aspect of the right to health. The objective of the engagement was to give communities an opportunity to contribute to and participate in setting an advocacy agenda to improve the situation of access to essential medicines at community, district, and national level. During the study, focused group discussions and information sharing were used to gather information and initiate community dialogue in Nadja and Nyenga sub-counties around health and access to essential medicines.
Accessibility is not actually very easy because sometimes you go to government hospitals and there are no medicine. Sometimes government hospitals are very far from them, so they have, it's not easy to access them. Someone lacks transport to the health center, and when they go there, an opportunity comes, then they don't get their medicine. So it's still a challenge accessing the medicine.
Even if you get the money for transport and reach the main hospital, still sometimes you're not being attended to. First reason, because of the many people you find, the many patients you find in the hospital. Sometimes you fail to get access to the doctors because they have so many patients to attend to. The next reason, there is a saying of the technical know-how, whereby if you don't have a doctor who can connect you, or anyone who works there who can connect you to the doctors or to the proper medication, you find yourself not getting the medication because there is no one there. Then sometimes if you go there, they tell you, if you, like for example, if you want to go for scanning for everything, they tell you to go and scan from outside, of which you have to pay some money. And if you bring back the results, they write for you the medication, they tell you that we don't have this type and type, such and such types of the tablets, you go and buy them from outside.
Lack of knowledge was cited as the major reason for many people getting preventable diseases. Respondents suggested that many people in their area fell sick because they do not know the importance of personal hygiene and domestic sanitation. The study also showed that HIV is an old and widespread problem in Buyikwe district, which is largely a fishing community, and for that reason, highly vulnerable to HIV infection. It was also noted that the opinions for the community to hold duty bearers accountable were limited, and that there was no formal collection of people's views before the budget conferences are held. The study recommended stigma should be fought at the community level through HIV sensitization and male involvement in antenatal care. Discordant couples need special support through post-test clubs and tools for positive living. Community participation needs to be improved by strengthening health unit management committees and empowering them to hold their leaders accountable. Today, with support from AIDS and Rights Alliance in South Africa, CEHURD has facilitated establishment of community health advocates in Buyikwe district who are sensitizing communities against stigmatizing people with HIV and also mobilizing communities to participate proactively in the access to medicine discussions of the community health centers.
While the policy of government is to give free medicines to the public in government hospitals, this real situation is quite different, because at the end of the day you find that medicines are out of stock for a long period of time. Secondly, we don't have health workers. So prescription is almost not there in many situations.
Another study that was conducted under this project was to assess prevalence of high-risk factors for non-communicable diseases among university students in and around Kampala.
I think it's becoming increasingly important that we stop focusing on communicable diseases, but also start looking at the burden of non-communicable diseases. This is extremely important because, one, as our population grows, we are actually having so many old people dying as a result of non-communicable diseases, things like cancer. We have lost judges. I think this year just 2 judges have died as a result of cancers.
The purpose of this meeting is to initiate our study on non-communicable diseases, as you may have noted from our activity plan for this month. We are following up our research from Chankwanzi and Chiboga on tobacco. We have noticed that from the study results, tobacco is a major cause of non-communicable diseases, and in Uganda, we do not have reliable data. Today, I just wanted to inform us that we have identified a consultant to carry on the study, and we are going to be supporting the study in the field. We're going to collect data from universities and using surveys and questionnaires that I have.
This study assessed knowledge, attitudes, and practices of students from Makerere University, Nkumba University, Kampala International University, Uganda Christian University Mukono, on the 4 modifiable risk factors for non-communicable diseases. A self-administered questionnaire was used to collect data from a total of 2,000 respondents in November 2013.
I thought that maybe making a case study of the students at the university would be very relevant. This will help us understand the targets that we should have. It will help us understand the messages that we develop, because they are going to tell us their perceptions and attitudes on the same. So it's a very timely study that we think will not only help the health system, but it will also help the youth that we are working with.
Okay, during your life, how many times have you used drugs?
Of course, once.
Once, okay. Which drug have you used? Marijuana, njaga, opium?
I have no idea. Oh, I have sniffed fuel.
The findings included up to 67% of the respondents either did not know what non-communicable diseases were or could not specifically describe them. From the responses, 1/4 of those that had never taken alcohol had their first drink when they were between the age of 10 and 18 years.
How old were you when you first had your first drink of alcohol?
I think I was around 7.
7, right, 7. You're an early drinker.
I was just trying.
And what type of alcohol was it?
Was this thing, is it called Tonto?
Tonto,
Yeah.
and right, Tonto.
About 15% of the respondents were current tobacco smokers. The recommendation of this program then was that there is need to increase the level of awareness of non-communicable disease factors and strengthen protective factors among children and adolescents. CEHURD, with UNDP support, has reached out to university students through formation of student health clubs that are doing sensitizations through peer-to-peer engagements and messages.
What health club is all about? Do you promise that we move health club forward? and paint the face of Kampala campus right from today. Are you promising to educate the rest of the people out there about what we learned today?
The health clubs are the foundations for a durable, self-sustaining program. With CEHURD's guidance and input, the health clubs are developing plans of action to reach out to the students during the health awareness weeks and health days. The clubs will facilitate sporting events, information education and communication briefs. They will advocate for smoke-free zones in halls of residence, good nutrition and exercise through regular sporting events. CEHURD has found strong sources of student enthusiasm, and we will use that enthusiasm to make sure that the program resonates with the student's body.